the Upper Nile, one of man's first great civilizations arose. The ruins of Thebes and Karnak can still be seen, the temples and monuments of the kings who ruled Egypt in antiquity. Today, Egypt is entering another age of progress. Rich in resources that have long been untapped, Egypt is beginning to learn the skills and techniques of the machine era. A few modern plants already exist, but to meet the industrial needs of its large population, Egypt is encouraging the investment of outside capital. Although industry is important to the nation's future, it is in the rural districts that Egypt is concentrating its efforts to improve the life of the people. For centuries, the farmers and villagers have carried the burden of poverty, ignorance, and disease. Today, village centers are being built to help them. These centers are sponsored and staffed by the Egyptian government, but some American advisors are present to assist in the health and education programs. Working side by side, Americans and Egyptians are training young nurses in modern methods of treatment and sanitation. Iran's water flows from the mountains in the north. It is brought down to the arid plain by a system of canals, or underground canals, that are tunneled between open shafts. The men dig until they strike rock. Then they tunnel laterally to join the next shaft. The building of canals is a remarkable feat of engineering, for the slope of the underground canals must be so calculated that for over many miles the water maintains a constant, even flow. Yet many of these workers are unable to read or write. They determine the amount of their day's pay by counting the piles of rock they have hauled up from below. In the past, Isfahan was the capital of Persia. It is a city of famous mosques and palaces built by the Shahs. Isfahan is a city rich in history and culture. It is also a city of poverty and disease. The tubes that bring in water are used for every purpose. They are typical of conditions that must be improved. The American Assistance Program in the Isfahan region is directed by Dr. Lucy Adams, who for many years worked with the Navajo Indians. Each day, letters requesting help come to her office. These letters are referred to the local Iranian authorities, who screen them to see if they express a sincere desire for improvement and should be investigated. One of these letters came from a village named Daskerd, describing a half-finished school the people of the village had begun building on their own. But their funds had run out. They were short of materials to complete the construction. The letter was simple and eloquent. Would the Americans be willing to help? This required investigation, and plans were made to visit the remote village. A conference table was set up in the center of the village, and Dr. Adams met with the village council to talk over what could be done. They explained in detail how they had started building their new boys' school several years before. The village contributed the land and materials. With local labor, they had completed the walls and roof. But now they were unable to go on. It was evident that these people were genuinely interested in giving their children a better education, that they had in fact done as much as they could with their limited resources. Assistance would be clearly in accord with the program's principle of helping those who were working for their own progress. After a careful investigation and long discussion, an agreement was reached. The village council would give still more materials and labor. Point 4's share, under its agreement with the Iranian Ministry of Education, would be the finishing of 2 rooms, paint for the walls and floors, doors and windows, some plumbing facilities, and benches, desks, and chairs for the children. The contract was signed. Work began again. The Iranian Ministry of Agriculture are visiting outlying farms to inoculate the cattle and sheep. American cows and chickens are also being imported for stock improvement purposes. They are about twice the size of the local breeds. American technicians are also teaching young Iranian girls the fundamentals of nursing. The medical needs of this area are staggering. It is imperative to get people with at least elementary training in health and sanitation out into the field.